Hey everybody, I'm Dr. Allison Key at Spa 316. I'm going to talk to you a little bit today about Beautifil, which is laser liposuction. It's a procedure we offer currently here in our Carrollton location for Spa 316. And as a physician, I'm the only one qualified at this location to offer this treatment. So it is liposuction, but it differs a little bit from traditional liposuction in a few ways. First of all, you are awake through the procedure, meaning that we make you really comfortable and maybe a little loopy, but you're awake. You're not put to sleep like you would be for traditional liposuction, so it lowers some of the risks. It is still somewhat of an invasive procedure, so you'll have a consultation first, and we'll go over your medical history and your goals and make sure you're a good candidate for the procedure. We can suck up to almost 2 liters of fat out with this procedure, and we are literally sucking fat out. It's very much like traditional liposuction, and that limitation is the same. Most patients, we get around 1 liter out, sometimes up to 15 to 1800 milliliters out, but you can take up to 2 liters out. You are awake for the procedure, like I said, very comfortable. We give you medication, so sometimes that's the limiting factor because we really want you to be comfortable throughout the procedure as well and feel very little discomfort. When we do the liposuction procedure, we start with what's called tumescent anesthesia, meaning that we'll take a small syringe with some lidocaine, we'll numb a few spots that we've marked during your pre-procedure intake, and we will make small incisions. I mean teeny tiny little incisions, and then we'll take a cannula and we'll put about 1 liter of fluid in the fatty layer of your abdomen or treatment area. That fluid contains lidocaine and epinephrine, and it just kind of floats up and numbs that fatty layer that we're about to suck out. That soaks for 20 or 30 minutes, gets you good and numb. In the meantime, you've had some medications by mouth that make you also very comfortable and relaxed. We do it right here in this room in a semi-sterile environment. Once you're good and numb, we'll come back in. We take a cannula that looks just like a traditional liposuction cannula, or very similar to a traditional liposuction cannula, and we suck the fat out. The difference is this also has a laser built into it. So as we're sucking the fat out, the laser's on, and we're kind of cutting that fat out as we go. You don't feel any of that. But what it does is it helps preserve those tissues, and it makes it a less aggressive procedure than traditional liposuction. So when you're done, you're not covered in bruises, your downtime, the soreness is much less compared to traditional surgical liposuction. The laser, like I said, helps kind of cut it free, helps preserve those tissues, because the other unique thing about Beautifil is that now we can take the fat that we suck out and transfer it to another location. So areas that can be treated include your abdomen, your inner thighs, the backs of your arms, even below your chin. We can suck fat out of all those areas. Then we can transfer that fat. So once the fat's transferred into or sucked out into a sterile canister, this one clearly is not sterile because I'm touching it, but we'll suck it into a sterile canister, and then that fat can be processed, just broken down a little bit to make the molecules smaller, and we can re-inject it. We can use it in face, lips, we can put it in breast tissues, so you can take fat from your bra area, abdomen, we can transfer it to your buttocks for like a sort of a semi-BBL procedure, put it in your breasts for sort of a breast lift or semi-augmentation. You can transfer up to 250 milliliters per area, so 250 milliliters to each breast or to each side of your buttocks if you wanted to do a transfer. A lot of women say, I want you to suck it out and throw it away, and that's okay too. I say women, this is for women or men that we can do this procedure. It's not a tummy tuck. It is not a weight loss procedure, but it does remove up to 2 liters of fat from a problem area or problem areas. We can treat multiple areas in one session. We can do abdomen and inner thighs, or we can do arms and legs, and we transfer at the same time that we're doing the procedure, so it's kind of a one-stop shop. Recovery is not too bad. So the day that you have the procedure, you'll need a driver, and we'll, when we're done, we'll get you all bandaged up. We'll take you out to meet your driver, your caregiver, excuse me. You'll go home and sleep it off that day. The following day, you're going to be sore. Most of our patients have not required anything more than Tylenol or ibuprofen to get them through that day. You can get up and take care of yourself. You can go to the bathroom. You can take a shower. You can fix a meal, but you're not going to want to do anything strenuous. You need to kind of plan to at least be off that day. Usually by the third day, patients are kind of getting back to normal. You still may have some soreness, but as long as you don't have a strenuous job or activity that you're aiming to do, you can kind of get back to normal by the third or fourth day. Now for 10 days at least, we ask that you don't do anything strenuous, no heavy lifting, nothing over 10 or 15 pounds. Sometimes young moms will struggle a little bit with that because they've maybe got toddlers at home. Whatever you feel comfortable doing is okay, just nothing too strenuous. You just want to give time for those small incisions to heal. You don't have any drains, you don't have any stitches. You more or less have what we call a steri strip, a little skin closure bandage, and then a clear Tegaderm pressure bandage over that. Those will stay on 3 or 4 days and then they'll come off. You're going to come in several times throughout the course of this recovery period just to check on those incisions, be sure they're healing well, and to continue to get some progress pictures for your sake so you can really see the progress you're making. Full recovery, final result, anywhere from 6 to 12 weeks. I tell patients if it's something that you think you might want to do more than once, wait that full 12 weeks before you have the second procedure done, because your body's going to be healing, skin's going to be tightening, things are going to be moving into place. The other significant thing about recovery is when you are done with your procedure, the day of your procedure will help you put on a compression garment, so like a Spanx for whatever area you've had treated. So if you're treating arms, you're going to want something with sleeves. If you're treating abdomen or legs, something that comes up high. You'll wear that compression garment 24/7 for at least 2 weeks. I prefer that people wear it 3 weeks. The longer you can wear it, the better your result is going to be, because those compression garments hold skin and tissues where they need to be. So as the healing is occurring, those things tighten up and stay put kind of where you want them in that compression garment. Buy a couple of those, have a couple of those on hand, because you're going to be able to take it off, take a shower, put it back on to go to bed. So that is kind of a nuisance for some patients, even thinking about sleeping in a compression garment, but it really provides a lot of support. You'll get kind of used to wearing it, and in fact some patients wear it for 3 or 4 or even 5 weeks just because they say it feels so good and they feel so supported and feels like it's really helping their results as they go. We've had fantastic results. You can check our social media pages and website for some before and after. I have done probably between 30 and 50 of these procedures since we started them last fall. They've been very successful. It's appropriate for patients of all sizes depending on your goals. So just because you feel like you have a larger area to treat or have a lot of weight you want to lose doesn't mean this is not a good procedure for you. It's just a matter of setting the appropriate goals and knowing that sometimes it's not about walking out of here with a six-pack. It's about walking out of here more comfortable in your skin, more comfortable in the clothes that you wear. But ideally, the patients who've had the best outcomes are those that have just had sort of a problem area, a lower abdomen. All of us moms who've had kids, we know what it's like to try to get rid of that lower belly. It just gets stubborn, and the older we get, the harder it is to get rid of that. This is a great procedure to target that area. Beautifil has been one of my favorite things that we have added to the spa. It's fun to see the results and the change in women's bodies and confidence level after having this done. It is a more invasive procedure as compared to something like cool sculpting. So we always ask that you come in for a consultation and we talk about your goals, the problem areas, what you want to treat, and we talk about the benefits and the risks of each of these procedures to help you make the decision on what's best for you. The cost of Beautifil compared to cool sculpting, Beautifil's probably a little bit more depending on the area that we're treating or how many cycles of cool sculpting you're going to need. But there have been several patients who we've done a consultation, and based on the area that they want treated, Beautifil worked out to be less expensive than cool sculpting based on the number of cycles we thought they were going to need. So that's an important part of our consultation, is just really kind of helping you figure out your budget and what area you want treated and what your goals are long term, because this is a little more invasive and a little more of a recovery, but the results are factual. There's no guesswork in it. We know how much fat we're taking out and what's gone and from what area. So that's the wonderful part about Beautifil and what I've really enjoyed doing with this. If you have any questions, of course, you can reach out to us by calling 770-537-1236, or you can check us out online, post comments on our socials. We're always happy to reach out. You can email us info@316healthcare.us, and we'll be happy to reach out to you that way as well, answer any questions you may have. But again, consultations are always free, so we look forward to seeing you soon and helping you make the right choice for your body.